Good afternoon. This is Dr. McDaniel, and today is Thursday, May 3rd. As the introduction announcement stated, I'll be answering another viewer question, so thank you very much for the question. This viewer's question, it's funny, it was timely because I had just seen a patient. She sent this question yesterday. I had just seen a patient here in the office yesterday with the exact same situation. The viewer is 51. The patient I saw yesterday is 53. Neither of them are menopausal. Now, the viewer question was, she was wondering if it's normal to have heavy bleeding going through menopause, heavy bleeding with clots going through menopause. The patient I saw yesterday is 53, and she's been having cycles off and on for the last year. She'd said that in 2017 her cycles were every month, no issues, and then throughout 2018 the cycles were skipping. So she'd had a cycle in February, then another in April, another in September, one in November, and then the most recent one had been in February of this year. And then the cycle she came in with, and those cycles all of last year and this year were light for 2 to 3 days, light, kind of spotty, sometimes a smudgy brown. We call that staining. The spotty is just the pink little drops, but not a big deal for a couple of days, all of last year and through the one earlier this year. Now, when she came in with the cycle yesterday, it was because it had started on Thursday of last week and it was still going, and it was heavy with clots. When I saw her, she had what we call active bleeding, so I put the speculum in and I could see just the blood, just constant ooze out and forming the clots. So I'll give the information I gave her yesterday. So, and I've obviously, for the viewer question, I don't know the details if that's what's been going on with her, what her previous cycle history was, but in general, the scenario is that everyone is in the same position when they first start getting their menstrual cycles and when they start to no longer get their cycles. So when you first start getting your cycles, whether that's 12, 13 years old or up to 16 years old, is within normal limits. So we call that menarche, when you start getting the cycles. Arche means to start, meni is obviously the menses. So menarche, normal range is between 9 years old and 16 years old. So any young girl between 9 and 16 years old is expected to start her menstrual cycle if she has normal health. When you first start the menstrual cycle, everyone has what we call anovulatory cycle. So all of the hormonal connections are just starting, and anyone can have irregular cycles, either heavy long cycles, light short cycles, spotty, brown smudgy, couple of days, could be 7 days, could be every month, could be every other month, or irregular, every 3 months, every 6 months. It's an irregular pattern. And for most young girls, it's going to be for the first several months, maybe the first 4 to 6 months, up to 2 years is what we give. So within 2 years of starting the menstrual cycle, she should be on a normal pattern by the 2nd year. And that's what we call an anovulatory cycle phase, because all of the hormonal connections are just starting. The same scenario is present when we finish the menstrual life or reproductive life. So we call that menopause, when we're going out of getting the cycles and we're no longer getting them. And as I stated, I believe it was last week, that normal menopause range is between, well, the average range is between 52 to 54, and anyone who's 42 years old and over, up to 56, 57 is considered the normal range for menopause. At the end of the menstrual life, we also go through an anovulatory cycle phase. So we're not having normal, predictable ovulation patterns, and since we're not having predictable ovulation patterns, we won't have a predictable cycle pattern. So anyone can have irregular cycles, skipped cycles, have a cycle January, not again until April or May, or skip 6 or 7 months and only have some spotting in between. That's all considered within normal limits. Now, medically, we don't get excited if you're skipping cycles if the cycles are light or spotty, and as long as they're less than 7 days, that's considered normal. Now, we do get excited if the cycles are coming too close together. Too close together would be 3 weeks apart or closer. And we get excited if they're longer than 7 days, so heavy long. We also get excited if they're abnormally heavy for any given period of time. So in general, if they're heavy with clots, necessitating that someone would need to change the pad or it'll be soaked, they'll have an accident very frequently. So very frequently would be every 20 to 40 minutes. Or if they're bleeding so heavily that they're having symptoms from the blood loss. So shortness of breath, lightheaded, dizzy, those kinds of things. So we get excited because that's not what the average or normal expectations are for anovulatory bleeding. Now, you can potentially have those changes and it can be normal. So with anovulatory bleeding, you can have skipped irregular cycles or you can have an abnormal heavy cycle. That's potentially normal. But if you're on the outside of that anovulatory bleeding where you're having the heavy, long, or huge clots, then we evaluate you just to confirm that it's all due to anovulation and it's not due to a medical condition. So the evaluation is always the same. We send your urine to check for potential infection because infection can cause inflammatory changes, destabilize the uterine lining, cause abnormal bleeding. The cultures we check for infection are always a urine culture to see if it's a bladder infection that doesn't have the usual symptoms with it, and or to sexual infections, chlamydia, gonorrhea. We check your bloods. It's always the same hormone panel: pituitary, brain, thyroid, ovarian hormones, to see if the ovarian hormones are consistent with someone who's going through menopause, and to confirm that the pituitary brain, which is the prolactin, and the thyroid hormones aren't aberrant, abnormal, inducing the symptoms that one's having. Then it's an ultrasound or a sonogram. The sonogram is looking for physical changes inside the uterus. So a mass, a growth, a fluid collection, abnormal tissue buildup, that could be the source of the bleeding. Depending on how all of that pans out, if the cultures are normal, no infection, the blood panel, the hormone panel indicates everything's normal, either normal that someone's maybe not going through menopause yet, or the hormones are elevated that they are going through menopause, and the ultrasound is normal. Now the ultrasound does have to be done when they're not bleeding, and the ultrasound has to show that everything's normal and the tissue that's built up inside the lining of the uterus, that lining of the uterus is called the endometrial tissue, so it's the endometrial echo. If that endometrial echo is thin, there's no abnormal buildup, no mass, no growth, no fluid collection, nothing, it should be 5 millimeters or less. On average, it's usually going to be about 3 millimeters, but it should be 5 or less millimeters of thickness tissue that's built up inside the lining of the uterus. If all of that is perfect, then we say yes, it's due to perimenopausal symptoms. And if you've watched my broadcast before, you know I'm trying to stay under 10 minutes, so this is going to have a part 2. So that's the whole background and the workup, and then I'll give the part 2, which is the management for that. I hope everyone is appreciating the information. I'm trying to give information that's going to help someone in their personal life or daily living. This is Dr. McDaniel, and as the Facebook page and my YouTube page state, I'm here in New York City, Manhattan, Midtown Manhattan, around the corner from Macy's, around the corner from Penn Station. If you're in the area, please feel free to come by. We see patients, we take most insurances, we see patients without insurance, we take cash. Monday through Friday we're here, and I see walk-ins every day that we're open. You just call the office for the walk-in hours. I started a YouTube channel, so please feel free to go through the YouTube channel, access the history of information. So, and please, if you have questions, please send a message with the questions. I like having the questions because it just makes it easier to direct the information on a daily basis to what people want to hear. So I hope that's been helpful. Everyone, please have a great day. Tomorrow's Friday, so looking forward to hopefully here in New York nice weather, nice and sunny weather. Have a good rest of the day, and thank you for watching.